Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Steve Lettrich and Cristin Mount. Steve is the business operations lead at All Levels Leadership. Cristin is an intensivist, also affiliated with All Levels Leadership. Their Kevin MD article is a 6-step framework for new healthcare leaders. Cristin and Steve, welcome to the show.
Thank you.
Gary.
All right. So I'm going to ask each of you just to briefly share your story, and then we'll jump right into the article. Cristin, why don't you go first?
So I spent 24 years in the Army, all of it in healthcare. And over the years, as you do in the Army, you progress in leadership roles. I never quite lost that sense of overwhelm in the first couple weeks to months, depending on the magnitude of the job that I did. And so one of the things that I noticed is that initial period in a new leadership role can cause a lot of anxiety. There's a lot coming at you. And that was certainly my experience. And I certainly made a lot of mistakes. And so my goal is to help prevent other physician leaders and healthcare leaders new to leadership roles from making the same mistakes I did.
All right. Steve, you are the business operations lead at All Levels Leadership. Just briefly share your story and then jump right into the article that both you and Cristin wrote. And we'll talk about that.
All right. I am the only member of All Levels Leadership who is not a physician by trade. My career has been in healthcare, though, both in the Army, the federal government, and in the private sector. Project management, I've had the opportunity to lead teams, be in academia. Process improvement and project management are really my passions. And like Cristin, I saw lots of new leaders stumbling. And after a while, you start to see recurring patterns. And Cristin gave this presentation at the Women Medicine Conference. And I immediately thought, this is such a great mindset and framework for new leaders. And it felt just so universal to me because I said, being not a physician, I felt, wait, this also works for chief nurses. This would work for APP managers. It would work for business managers. This would have helped, so many people I worked with, in my academic job. So when she asked if I wanted to contribute to it, I was very enthusiastic to participate.
For those who didn't get a chance to read that article, just briefly tell us what it's about.
Well, we feel that there are two very counterproductive cliches or stereotypes that we see a lot of new healthcare leaders fall into. And it's because healthcare leaders typically don't receive a lot of leadership training before assuming a leadership role. You're typically good at your clinical or administrative job for a certain number of years, and then it's, okay, now congratulations, you get to be in charge. And we feel that these two negative cliches are hit the ground running and the leader who has all the answers. Two recipes for disaster, especially if you do them at the same time. So we want to try to present a framework to directly counter those two counterproductive stereotypes and spell out a lot of deliberate steps that new leaders often don't feel comfortable taking the time to do, but that we're trying to stress that you need to. So what are those steps? The first step is that you have to really become familiar with the organizational goals of both your boss and your boss's boss. That's about the maximum range that is really going to directly affect your decision making. But you have to do the research. If the goals are not immediately available and well published, you have to ask the hard questions and pull their priorities out of them. Once you do that, you need to do a needs assessment. Take what you believe are your initial goals, and do you have the personnel, the resources, to accomplish them. The third step is going to be reach out and make introductory contact with peer leaders at your level and key subject matter experts. So whether that's information technology, whether it's legal, human resources. We're not saying that you have to immediately develop a strategy to become besties with this person and be doing lots of working lunches, but you do need to go make the face-to-face meeting with them that will build that little social bridge and make it easier for you and more instinctive for you to reach out to them when you think you need help. Again, not being the leader who has all the answers themselves. Then in the article, we talk about our ways where we triage tasks using two different criteria, both of resources required and whether it's a short, medium, long-term goal. And we talk about how you can use those to properly prioritize your tasks and maximize your most valuable resource, which is your time. Mm-hmm. And then we just say that you need to continuously go back, revise the list, and adapt. We give you a way to start, and as you grow more into the job, you're going to realize that you miss things in your first go around. Just make it iterative. Set deliberate time to go back and go through our process of analysis again, say every 6 months, every year, and just make sure that you're still on track with the organizational goals. Did anyone new come into the organization that you need to go out and meet personally and develop a working relationship with? And make sure you have a system to constantly prioritize your tasks rather than just develop a huge task list and determine what looks good that day.
I love this framework because, as we all know, physicians don't get a lot of training, if any, on leadership. And like you said, hit the ground running is very, very common when it comes to physicians. So having some type of systemic approach, I think, would definitely increase their chances of success as a leader. Cristin, in your story, when you first introduced yourself, you said that you made some mistakes as you transitioned into a healthcare leader. Can you share one of those mistakes and tell me what's the biggest thing that you've learned from some of the things that you did when you initially went into leadership?
So many mistakes to choose from. So I think the one that sticks out as the most cringeworthy was right out of critical care fellowship. I was made the critical care director for the medical center that I was assigned to. And I found that I was the new person on the block, was coming in my office with the list of complaints. Mm-hmm. And I felt the need to fix those immediately. And so I would go out and try to fix one thing without really having the whole piece. And then that would lead to 3 more people coming into my office upset because this one thing had changed. And I created a real chain reaction of chaos in the entire section. And it was humbling when a great mentor pulled me aside and said, "Hey, let's slow down here. Let's go back to the beginning. How did you approach this?" And really coached me through some of those initial steps that we built into our framework. And each time as I moved into a new job with a larger chunk of responsibility, ultimately I finished in charge of all of the non-surgical medical care for the Army's major medical system up here in the Pacific Northwest. But each time I would feel that overwhelm. People were coming at me with things that need to be done or they want done. And if I fell back onto this framework, it at least gave me some space to stop and think before I acted.
So I'm going to encourage all listeners, of course, to go back and read the article and framework and really get more details, more so than we could do in this short podcast. So Cristin, for those other physicians who are thrown into leadership positions as you were when you just came out of fellowship, just tell me what the first step is. I know that there are 6 steps, but what's the first thing that new physician leader should do?
I think the most important thing for me that I really made sure I took time to do was to understand where I sat in the larger organization, right? So what exactly is it that my piece of this organization does? And what actual physical space do I own? What are my relationships to my peers? Are the nurses in the ICU under my supervision and mentorship and piece, or is that this person over here? And so just taking time to stop and look around and figure out how your piece relates and interlocks to everybody else around you is going to really be effective in terms of understanding how you need to triage when everyone comes in and asks you to do things, but also how you can help the organization move forward towards their strategic goals. So I think of all of the steps that we outline, for me, the key was always just to sit and really figure out, how do I work here? How am I providing patient care, and how does that affect the people around me, and where does that fit in the organization? And it's different every time.
Mm-hmm. Steve, you mentioned that you observe so many physicians as they transition into leadership. What are some of the red flags? What are some of the biggest mistakes that you've seen that you're going to warn physicians listening to this podcast not to do as they transition to leadership?
The first thing that I'm going to warn them not to do is to assume that because they are excellent at patient care, they can also figure out the implications of legal, human resources, information, technology. You asked Cristin what her, greatest mistake was. My greatest mistake falls in this way, and that's why I often push the developing stakeholder relationships so much. When I went to the hospital in Fort Campbell and I was put in charge of the emergency preparedness plan, mass casualties, natural disasters, et cetera, I did not do a good enough job in this completely new environment of going out and aggressively meeting all the subject matter experts in communications, safety, medical logistics. And I was much less effective for my first 6 months as I had embarrassing learning curves in my meetings. So, and that would be the main thing. I would encourage them to go out and, robustly interact with the subject matter experts. And when in doubt, ask the question, swallow your pride, get it right the first time rather than starting down a path and then finding out, oh no, I can't do that for this reason, and then having to go back and do rework. It'll save you time. It'll improve the morale of your team if they're not going back and fixing mistakes.
So, Steve, where can physicians get resources in terms of becoming better leaders? Obviously, I know you work for the organization, all levels leadership, but short of the organization, where can they find mentors? Where can they find people within their local organization in terms of better helping them transition into that leadership role?
This is where it's challenging, and we would say that we need to challenge senior healthcare leaders, senior supervisors, to culturally not just be managers and supervisors, but to be mentors to the junior people. Because it is 100% sure that if you are in a senior leadership position in healthcare, you have stubbed your toe, you have embarrassed yourself a number of times, and develop the culture of when someone new comes on, proactively tell them, make sure you are familiar with this policy, make sure that you are familiar with this person, make sure you're aware that these are our external stakeholders as well as our internal stakeholders. These are the key members of the community that you will be interacting with. Go meet them, learn about them. I wish I could say that you can go to a lot of the standard business books out there or magazines, but a lot of the things that you'll currently see in the Harvard Business Review or in a lot of podcasts that work in business give people freedom to be creative, leave 20% for personal projects. Those simply aren't available in the healthcare industry, but driven by RVUs and best practices. So you have to really lean on the subject matter experts within the organization to find what you can and can't do.
Cristin?
And then, so I would also remind listeners not to forget about your professional medical organizations. So, for example, I belong to the American College of Physicians, and we have peer mentorship, we have peer coaching, we have a leadership academy. The Women in Medicine Summit in Chicago is a fantastic meeting, but that organization also hosts a leadership academy. So I think the professional medical organizations that we already belong to also have mentorship, coaching, a wealth of knowledge, and sometimes individual programs that are available. So don't forget those more national resources, especially if you're not finding that mentorship and coaching, as Steve mentioned, in your own organization.
Cristin, as physicians go through training, they lead teams, right? As senior residents, as fellows, and as attendings. Why don't those leadership skills sometimes not translate into the business environment?
That's a great question. I think they don't translate into the business environment because as you're leading a clinical team, with respect to individual patient care, the focus is the patient and everything about the patient and their care, what brought them to you, where they're going from there, how the rest of the team is interacting to care for that patient. To make the analogy, when you're in a leadership position, as we think of in terms of healthcare leadership and organization, you're no longer focusing your efforts on that one patient. You're focusing your efforts on many people, on a large section, and that section is connected to every other piece of the organization. And you have to not only continue to lead, but you have to learn to follow. We talk at all levels leadership, we talk a lot about followership. So you have to transition into this mindset that you need to consider all of the other moving pieces that are attached to you as you're making your decisions and you're deciding what priorities are. So I think the innate skills of physician leadership that we recognize, that we get trained in just by the virtue of residency and fellowship training, I think those are the core nucleus of what make physicians great leaders. You just need a little bit more to take that step into organizational leadership. And some of that is time and experience, some of that's coaching and mentorship, and some of that is just taking a framework and jumping in and seeing what works and what doesn't.
We're talking to Steve Lettrich and Cristin Mount, both with All Levels Leadership. Today's Kevin MD article is a 6-step framework for new healthcare leaders. Now we're going to end with just asking you just to share some take-home messages with the Kevin MD audience. Steve, why don't you go first?
Kevin, you mentioned earlier that this is a lot to process in a short article and a short interview. We agree. And for folks that are interested in learning more about this, we are going to be hosting a webinar that is going to be available on our website starting in early March, where we'll go into this in much more detail, specifically the more complex issues such as triaging tasks. And if you go to our free resources page, there is a free workbook you can download that'll help walk you through some of these steps and will really augment the webinar. So we would encourage people to come to our website, find those resources. We also offer coaching engagements for this specific thing. But the main takeaway that I would say is, if you only remember one thing from our article, it is aggressively form those initial business relationships. They will pay off for years to come.
And Cristin, what with you? Your take-home messages.
So 2 quick take-home messages. The first is that this process that we've developed, this framework, is scalable. So this will work if you are a resident that's been put in charge of a performance improvement process. This will work if you are a healthcare leader that is moving into organizational type leadership, the entire spectrum. The second is that it takes practice. So practice, practice, practice. And practice doesn't have to be large and grand and in public. Practice is small things every day, right? So you could take this framework. I take this framework sometimes when my home management to-do list is exploding, and I take this framework and I apply it there. So look for opportunities for micro practice, and just remember that this framework is scalable to any leadership role, wherever you are in your career.
Steve and Cristin, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you.
Thank you, Kevin.